much of the work that we do is housed in a theoretical framework called social cognitive theory. And that social cognitive theory considers social, psychological, personal, and behavioral and environmental influences on behavior. And so there's a lot of kind of feedback loops involved, which can get quite complex when you're considering human behavior, which is in and of itself complex. One of the central factors of that particular theory is a variable or construct called self-efficacy. Now, self-efficacy is the beliefs that one has in their capabilities to successfully carry out courses of action. An easier way to think of it in layman's terms is it's like a situation-specific self-confidence. Now, it differs from what we normally think of as self-confidence, which is more trait-like, dispositional-like, pretty stable. If you know a self-confident person, they're pretty self-confident most of the time. Self-efficacy is not stable, in large part because it can differ. You can appear to be confident in one arena, and then you move to another domain, and you don't have any self-efficacy for that. So that's important in the context of trying to predict, particularly physical activity behavior, and some of the outcomes that we associate with physical activity behavior. So if you're a highly self-efficacious person, then you're likely to approach more challenging tasks. You're likely to put out more effort when you're engaged in that task, particularly if things don't go well. And you're also likely to persevere longer when you're faced with aversive stimuli or setbacks or obstacles. Now, the important issue there is that those are three elements that we can really associate with physical activity. You need to put some effort in. There are going to be setbacks, and there are multiple tasks and challenges to engaging in physical activity. So in that context, it becomes a nice model for trying to understand the behavior. Now, we've taken that model and we've applied it in a number of ways. We've used experimental trials in which we've brought people into our laboratories and then we've manipulated their levels of self-efficacy prior to exercise. We've had them exercise, and then we found afterwards that the manipulation of that level of self-efficacy has implications. It influences the extent to which they enjoyed it, the extent to which they experienced positive emotions and affect, and also the extent to which they are willing to continue with it. So it's a nice way of illustrating that this is not some immutable construct in terms of influencing behavior. It can be manipulated. And that becomes very important to us when we start to do our randomized controlled trials, which is the cornerstone of our work here, where we have randomized older adults into various conditions. And in order to see just how self-efficacy works, we've actually conducted a couple of trials, both with older adults and with individuals with multiple sclerosis, where we've randomized them into what we term an efficacy-laden exercise intervention, or just your regular run-of-the-mill exercise intervention. And we're clearly able to show that compliance levels are higher in that efficacy-laden intervention than just the regular activity. So that has very important implications from just a translational sense. If you're putting together programs for rehabilitation for older adults or for adults with disease, then there are ways that you can manipulate the environment. And we do that in a number of distinct ways. We provide lots of feedback. We monitor their behavior, we chart it, document it, and show them how they're progressing. So they have a frame of reference with which to say, oh, that's what I could do, this is what I'm doing now. That makes them more confident. We monitor their levels of exertion and their affect and enjoyment to show that that's changing. We actually monitor their physiological responses and give them feedback on that. So we can say, look, you're exercising longer, you're exercising harder, but still your heart rate is remaining the same. So you're getting now some physiological benefits. Your body is adjusting to the stress. I liken compliance is probably the worst issue, the biggest issue, I should say, in modern medicine and health promotion. We can reliably state that more than 50% of people drop out of exercise programs before the first 6 months. That perfectly parallels the compliance rate in medication usage, or the extent to which people follow their rehabilitation. And a good analogy there, or example of that, is to simply ask yourself, when a physician has prescribed medication for you to take, A, have you taken it all? B, did you take it according to plan? Or C, did you self-prescribe, which is what a lot of people do. So adherence compliance is not a small issue. We've since gone on to use this model to try to understand some of the outcomes associated with physical activity, in particular with older adults' functional limitations, because that has implications for onset of disability and therefore reduction or loss of independent living, and its effects, the role efficacy plays relative to physical activity effects on quality of life. Now, for a long time, people have had a relatively straightforward understanding based on the literature that if you're physically active, you have fewer functional limitations. If you're physically active, you have better quality of life. So it's a one-to-one. That's patently untrue. And what we have argued is that there are intermediary variables, intervening variables, mediating variables, one of which is self-efficacy. We know physical activity influences efficacy, and we know physical activity associated with functional limitations and having a better quality of life. But in actuality, when you statistically control, you take self-efficacy out of the equation, those relationships are either diminished dramatically or go away entirely. So having a sense of self relative to your confidence and ability to carry out activities of daily living is tremendously important, particularly to older adults. We have conducted several randomized controlled trials over the last year with my longtime collaborator, Art Kramer, where the primary outcomes have been cognitive function, brain structure, brain activity. Any hypothesis that we have had about relationships between those things is predicated on the fact that we can actually get people to exercise and keep them in. So we saw a training effect, and ultimately so that we show an effect on cognition, brain structure, brain activity. We have taken our work using the self-efficacy model and embedded what we have learned in our previous trials in all of the trials that Art and I have done together. We show quite successfully that we can get people to stay in a program for 6 months to approximately 85% adherence, retention. Retention, adherence, different words. That's pretty good. And it has to be good for us, in large part because without that, we really don't have anything. So why is it that people don't exercise? I mean, I often tell my undergraduate students that if I were to have you go conduct your own little study in Champaign-Urbana, you each ask 10 different people, black, white, young, old, educated, uneducated, is exercise good for you? They would rattle off 10, 15 answers that are completely correct. And then when you ask them, and how often do you exercise? Oh, I don't have time for that. And there's the crux of the matter, is time management is an incredibly consistent reason people give for why they don't exercise. So why is that? Well, we live in a very demanding society. We have more and more put on us all the time. But we do know that in order to get positive health benefits, you don't have to do too much. 30 minutes a day of light to moderate activity on 5 or more days of the week will get you the health benefits that you need. And you can get that by going and having a brisk walk. That's all it takes. And of course, our participants say, oh, I don't know if I could fit that into my day. So we try another approach, and that is, well, let's see if you can accumulate them. 3 bouts of 10 minutes. A strategy we give to people when they leave our programs is, well, if you're going to exercise at home, you have a stationary bicycle or a treadmill, do your 10 minutes while you're watching part of the news, then go off and do what you've got to do. Come back, do another 10 minutes while you're watching on your favorite television show when the commercials are on, because there's way more than 20 minutes of commercials in an hour television program. So anything like that, we can get them to do that. But time management, huge problem. Other obstacles, particularly for older adults, are inaccessible facilities. By that, they don't have anywhere to exercise. If they live in poorer neighborhoods, those neighborhoods are environmentally unfriendly for a variety of reasons. Cost of exercise is for some of them problematic. What we try to do is offer them alternatives, especially when they leave our programs, about where can you exercise for free or minimal cost? What can you do in your own neighborhood environment? Give them as many options so it negates the number of excuses that they have. Promoting exercise across the lifespan is actually a pretty lofty goal when you realize that all the population statistics will tell us that for adults 65 and older, about 28% of them meet public health guidelines for physical activity. And that has not changed dramatically over the last decade or so, in spite of a much greater public face of physical activity. So we do it through our research, obviously, but we also try to do it through public forums as well, whenever we can, to address non-research groups having our work published and advertised in kind of non-research type journals or articles or papers like that. And anything we can do, we try to do it. We're having a very hard time trying to get people to be active. Just this month, the new federal guidelines for physical activity were released by Department of Health and Human Services. And they've changed their tact a little bit. Now it's not, we want you to exercise 30 minutes a day, light to moderate activity, 5 or more days of the week. We want you to do that, but we want you to do it your way. It's kind of like a Frank Sinatra approach to things, exercise my way. So suggesting that they can pick up exercise in a lot of different ways, walking the stairs rather than taking the elevator, parking your car in a distant parking lot and walking there, getting a 10-minute walk down to the coffee shop during lunchtime, things like that. We're hopeful. I see us in the work we're doing with cognition and brain structure and activity is I think we've pushed some envelopes here at Illinois, and we're setting the stage a little bit for what we do know about those relationships with physical activity and fitness. And the one thing we do know is that older people really value their cognitive abilities because it has huge implications for independence. So if our message can be gotten out there, and I really mean it's a message, I don't think I'm not sure we're the ones that should send it because we're the ones doing the research, but we should have a hand in this, I suppose. If we can get that message broadcast further about the cognitive benefits, I think then we will have an impact on society. I worry greatly that people see games that they can do on their computer to potentially influence their cognition, and basically they're taking a sedentary activity, whereas if those things work, they do get some cognitive gains, but if they're physically active, they get the cognitive benefits, but they get all of the other physical and mental benefits as well. In essence, it's a much bigger bang for the buck.